Hello everyone. I started doing these videos actually right after I had a major adrenal fatigue crash because honestly I was shocked. I was literally shocked to all of the sensations and symptoms that my body was having during that crash. And I had that third crash while I was driving in my car, and it literally made me feel like I was going to die in my car. And I felt as if I was going to die, and I thought to myself, I just need to make it home, because if I was going to pass, I wanted to pass at home. And some people may think, wow, I would have gone to the hospital or, tried to go to a police station or get help somehow. But I had had such bad experiences in the past with hospitals and doctors of going there for various things, and they were never really able to help me very much at all. So my intuition said, go home and don't go to the hospital. And I'm very glad that I didn't go to the hospital, because I probably would have died there, highly likely, because the medical model doesn't know how to treat adrenal fatigue at all, and they don't really know it, period. So what I did was I made it home, and I decided that I would go to at least my PCP's office and talk to him, because I was able to get an appointment the next day, and just talk to him about my symptoms, as well as get some blood work. And the blood work, of course, didn't show anything, which is quite common with adrenal fatigue. So just know that it's not an uncommon thing for nothing to show up in your blood work. And but when I was talking to him about my symptoms, I noticed that he was starting to go down this road of talking about anxiety and depression, and I knew that was going to happen. And I told him that I had anxiety at one point in my life. I know what that was like, and I had depression, and I know what that was like. And I said, this is not what it is. And I could see how this was registering with him, because I know that typically they want to label you with something and then, give you a pill to take care of it. So I was like, literally thinking while I was talking to him, and at one point I said to him, I said, I don't think you're really listening to what I'm saying. And then I started to get really, really scared, and felt like I've got to get out of here, because it was really hard for me to be there as it was, because of how poorly I felt. And so once I got home, I knew that I didn't know what to do, because I knew that I was very, very ill. So I talked to my partner, and I remember I said, because I didn't know what to do, so I said, she said, maybe you have adrenal fatigue. And I know that we had discussed it, like, over the years, the words, came up, but she didn't know much about it, and I didn't either. But for me, it was like, okay, adrenal fatigue. I Googled it. I saw the first doctor that came up for adrenal fatigue was Dr. Lamb coaching. So I said, I took a little online questionnaire. They give you a free consultation. And before I knew it, I was on their program. And that's what I'm doing. I am doing the Dr. Lamb coaching program. But I want to say that when you are in advanced stage adrenal fatigue, it's shocking, the symptoms and the sensations that you're experiencing throughout your whole body and mind. And you're not able to have any control over what's happening in your body. It's like on this cycle, if you will, or it's your body's in chaos. It cannot regulate many of the different circuits that are naturally occurring in your body. And it just doesn't have the ability anymore because your adrenals handle your cortisol, which handles your stress. So, but what I'm trying to say is the first step is to get diagnosed by someone that knows about adrenal fatigue, or symptoms that you've had for a long time that just don't make sense to you, and they really can't, the medical model can't really figure out what's wrong. So you have to get diagnosed properly, because this syndrome gets diagnosed with a host of other different labels that really aren't what's happening to you, that aren't it, you know. So get a proper diagnosis and find somebody that's a specialist in this area of adrenal fatigue. There's so much information available now online and on YouTube. But I really, really have had a great experience with the Dr. Lamb coaching. They're professional. They're available. The Dr. Lamb had it himself years ago, and he developed a protocol to help people. And he knows how ill that you can be with especially these advanced stages. He's written a number of books. His website is wonderful. It's very extensive. It has testimonials you can look at. It's just so helpful. So you take a little online questionnaire, and again, you get a free consultation. And like I said before I knew it, I was on their program. So that's the first thing. And because it's very confusing, because you've probably been to a lot of doctors and have been labeled this or that, and you're really not feeling any better even with any type of medication that you're taking. And so that's what I did, and I've been with them for quite a while now, and they saved my life. But you have to have a lot of patience, a lot of patience. It's a very slow recovery, so it's just part of it. You know, it took a long time to get to the level that it's at, and it's going to take a while for you to heal from it. So have a lot of patience. You have to be very grateful, very positive, do adrenal breathing, and And initially, when you're so ill, I mean, I was bedridden for months. I had to quit working, months and months actually, and I had to quit my job immediately. And it's, it's serious. And so what was I saying? Excuse me. But you do have to, you have to eat very clean. You have to drink a lot of water. You have to do whatever it takes to get better, and you have to, commit to it. I don't have just so many things I had to cut out of my diet, and it's just what you have to do to get better. You have to stay calm and have no stress, and that is very challenging, because I remember when I just quit, stopped working, and I've had people pass during my recovery, and you just basically have to feel your feelings and move on, quickly. But I just wanted to give you a heads up on that's what I did. That's what's worked for me. And if you have any questions or comments, please feel free to leave them down below. If you like this video, please give it a like, thumbs up, and if you could please subscribe, that would be wonderful. I'm going to have more of these videos available. But I thank you very much for listening. And again, if you have any questions, you can certainly comment below and I will get back to you. Really appreciate you listening. Bye-bye.